Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
COX. The COX is cyclooxygenase. Actually, in the membrane, there is arachidonic acid is present in the plasma membrane of all the cells. This arachidonic acid gets converted to phospholipase A2. Sorry, phospholipids. Okay, it gets converted to phospholipids. This phospholipids, in the presence of phospholipase A2, it gives rise to two things. Sorry. Arachidonic acid gets converted to phospholipids by the enzyme phospholipase A2. Now, this phospholipids now has two pathways. They have two enzymes. They can go through cyclooxygenase pathway or lipooxygenase pathway. When they go through cyclooxygenase pathway, they produce prostaglandins G2 or H2. These prostaglandin G2 H2 will produce the next congeners of prostaglandin like prostaglandin D2, E2, F2 are formed, prostaglandin I2 or prostacyclin is formed, and thromboxane A2 is formed. Whereas when the phospholipid will go through the lipooxygenase pathway, this lipooxygenase pathway will produce leukotriene A2, which gives rise to leukotriene B4, and it will also give rise to leukotriene C4, D4, E4. So these leukotriene C4, D4, E4 causes bronchoconstriction. So these cyclooxygenase or COX, these COX pathways or cyclooxygenase enzymes are of three types. We have cyclooxygenase 1, cyclooxygenase type 2 and cyclooxygenase type 3. Cyclooxygenase type 1 is a constitutive method and it is gastric protective, whereas cyclooxygenase type 2 is an inducible one and it is inducible and constitutive in brain and kidney. This COX2 will cause inflammation and carcinogenic, whereas COX3 has pain perception, is important in pain perception in central nervous system, and COX3 is mainly inhibited by the drug paracetamol will inhibit this COX3.
thank you and thank you for watching.